Good morning. It's your daily dose of complete health with your local chiropractor, Patrick Hogg. Joe, I had such a nice evening yesterday, and I was at work. So we've started doing health classes back in the clinic. Now, interestingly, our health class last night actually ran a lot longer than I anticipated. We normally run our health classes here at Complete Health for around 45 minutes. We normally run our health classes here at Complete Health for around 45 minutes. But actually, it almost became like a little bit of a group therapy session last night. Well, why? Well, we get down to people's levels and start actually explaining and breaking down health in really simplistic terms. And what ended up happening last night, when we were doing our health classes, we started going through some of the main causes of dysfunction and disease in the body. So stuff like what happens with our nutrition, what starts happening with our mental health, our physical health, how does this start to have an effect on our brain, our nervous system, and then our overall health, and how then our body can start to function, or in most cases in the 21st century, start to dysfunction. However, what it seemed to become was much more of a Q&A, where it almost felt like everyone was trying to catch me out and try and ask me questions that were going to be a little bit awkward, really to test the knowledge of what's going on with the body or in people's health. Now, interestingly, there was always a very simple answer. And once we've been going through a couple of really basic concepts with everyone, when people started asking me questions time and time again, I would go back, okay, so what have we so far learned? And by the end of the class, other people in the room were able to answer people's objections. By the end of the class, people in the room were able to answer other people's objections. So why does my sister get X? Or why does my get X? Or why does my... And people in the room were going, well, have they checked this? And have they checked this? And essentially, we went through the three most common causes of disease and dysfunction, which is physical, chemical, and emotional health. And we started to break it down, because when we really look at the World Health Organization's definition of health, it's complete physical, mental, and social well-being, and not just the absence of disease. And when we break it down to that really basic concept, how many of us are actually really, really healthy? Now, the other interesting thing that we do not do enough as health practitioners, and I'm going to continue to keep doing this, is we do not help people to help themselves. When we attend to see our doctors or our medical practitioners, or even in a lot of cases, our physios, our massage therapists, we almost always only ever go when there's a problem. We almost always only ever go when there is a physical problem with our health. Now, what is the problem with that? Well, let's just take the example that we used last night. If we only ever water the plant once it looks like it's starting to die, what we are starting to let happen to that plant is physical damage will start to occur to that plant. Physical damage will start to occur to that plant. It will start to wilt. It will start to die. And if we do not water that plant before it dies, guess what is going to happen? It's never going to come back. Now, if we water it too late, it may come back a little bit and it may hang on for a little bit, but again, it will still implicitly die. Whereas if we try to catch that problem early, and it's only a small problem, that plant will bounce back very quickly. But if we water our plants on a regular basis, before they even start to show the signs of wilting or dysfunction, then we will start to see that plant will go through a long life looking healthy, assuming it's got all of its nutrients, the sun, the water that it was always meant to have. That plant will be healthy. Now, our bodies are exactly the same. However, we never look at them in the same way. Now, chiropractic looks at you as the plant before you're starting to wilt. So once we've got you healthy, once we've really helped our clients get to that point, why on earth would any practitioner on the planet want to let their client leave their practice without making sure that that person then knows how to look after themselves. Because this was the interesting conversation that we were having. Right now, in this moment in time, it is almost impossible to get appointments with doctors or physios or any practitioner in regards to your own physical health. Why? Because it's overrun in a way that we have so many chronic problems that are due to lifestyle that people could help themselves but haven't yet learned how to do it. Now, it is not a GP's job to teach someone how to live. Their job is to prescribe medicine. Do you know why? They've done a degree in medicine. It is our jobs to ask the right questions and identify the weaker spots in our lifestyle so that we can start to address the problems ourselves. So one thing I'm going to continue to do with all of my clients, I'm going to be doing these free health classes. They're going to be on every 2 weeks. Our last one was last night. So our next class is going to be 2 weeks yesterday. It's there at 7 o'clock in the evening. We normally start around kind of 10 past 7, but generally I'm always aiming for around that kind of 7 o'clock mark. And I'm going to continue to keep teaching this stuff so that people can start to learn how to actually take care of themselves, because at the moment I don't feel like anyone else is doing it. I don't feel like there's any other practitioners in Eastbourne, chiros, physios, dentists, whatever, that are teaching their clients how they can actually start taking some ownership about their health. So in the long term, not maybe they can only manage their low back pain or their neck pain or their headaches, but then we can start to look at other chronic diseases like heart disease, cancer, diabetes. By changing someone's lifestyle factors, by improving their physical health, by how much they walk, how much they exercise, by improving how they think about themselves and the approach that they take towards their health, and actually consciously thinking about how they do things and taking care of their mental health, and then taking care of the foods and the supplements and also the amount they expose themselves to other chemicals, we can really start to help people take ownership back of their health so that they can really actually influence and express that health that they were always entitled to. And I believe that if we can continue to keep doing that, that even if I only change one life, one person that didn't get cancer, one person that didn't develop that heart disease, then I have solely done the job that I was put on this planet to do. So this was your daily dose of complete health with Patrick Hogg, your local chiropractor, going on his rants, getting super excited about the fact that we're in the trenches with you guys. I'm bringing it down to your level so that we can all understand health at its very basic core principles, but in a way that's digestible and people can take action immediately today. We'll speak to you again soon. Take care for now.